Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Cassie Mathis, a certified practitioner in orthotics and prosthetics and the owner of Baby Bear Clinic in Appleton, Wisconsin. Cassie's career journey was originally inspired by her niece's orthotic needs, and after extensive schooling and experience within the field, she decided to start her own clinic in 2020. Baby Bear Clinic specializes in cranial remolding helmets, braces for conditions like scoliosis and leg instability, and other custom pediatric orthotic needs. Cassie's approach integrates the latest technologies with a family-friendly feel to ensure the best care while reducing stress for families. When she's not at the clinic, Cassie enjoys running, playing pickleball, and cheering on her 3 sons at their sports games. We're excited to have her on to share how families can navigate pediatric orthotic care with confidence.
All right, welcome back, you guys, to the podcast. We are excited to welcome Cassie back from Baby Bear Clinic. We had a really great discussion in the last 2 episodes about cranial helmets, flat spots on babies' heads, just some really great conversation. So we really recommend taking a listen to all of those. But in this episode, we're going to be talking more about something new you're kind of diving into. It sounds like you've recently decided to expand your business towards helping fit individuals with braces for conditions like scoliosis or like support for leg stability. So who needs lower extremity bracing? What kinds of conditions would these kids have?
Yeah, so lower extremity orthotics is going to be anybody who would need some sort of support to their limbs. So whether they have a deformity like clubfoot or they have an instability or weakness, conditions that are going to kind of typically fall into there or that we're going to, most often kind of see on repeat is going to be spina bifida, cerebral palsy, muscular dystrophy. Oftentimes kiddos with Down syndrome might have some muscle laxity or weakness. So those are kind of the main categories, but they can also fall out. Sometimes kiddos, especially when they're a little bit younger, might just have kind of an idiopathic weakness. And it's not necessarily attached to a diagnosis, but you can just see those atypical gait patterns and see that, hey, they might need a little bit of stability.
Yeah. Are there different kinds of braces? Or is it usually the same kind of brace on the areas?
Okay, good question.
Yeah.
Get ready for a long answer.
Okay.
There is lots of types of bracing. So AFOs is going to be your typical ankle foot orthosis. So it's going to go up above the ankle, kind of end just below the knee. SMOs are another really common type of brace. It's supramalleolar orthosis. It's going to go just above the ankle. There are also like full leg braces. So I'm not going to go into those too deep because they're not as common, but you can get kind of like the full Forrest Gump, like full leg braces. Okay. But most often it's going to be like an AFO or an SMO. Now there's different types of braces. So not only different manufacturers, but also different materials. Plastic, a thermoplastic design is going to be kind of our most traditional, but with technology, we've really made improvements in bracing. And like I mentioned, Forrest Gump, like the metal,
I was just in wood
like leather. Yep. Yeah. Those are still around and appropriate for some patients, but really we've evolutionized, the types of plastic, the movement that plastic can have. 3D printing, we mentioned 3D printing in helmets. That's also become really prevalent in our other bracing. So in lower extremity bracing, in prosthetics as well. So yeah, there's a lot of different types. Carbon fiber is another material that's been around for a while now, but still kind of a newer advanced technology. So there's lots of different types of bracing. And not to jump ahead too far, but that's something that we're going to really go through and kind of look through different treatment options and what works best for that specific patient. These are custom devices. These are made to that person's specific measurements, shape, and also lifestyle.
So when you sit down with somebody and they're looking for braces, you go through all of the different options and you have access to all of these different things then too.
Mm-hmm.
Okay.
Yeah. So a typical evaluation for a lower extremity weakness is going to look like we're going to collect a history, like a questionnaire to get some history. If they've, we're just starting this. So if they already are an established brace user, they've gotten that from somebody else. So what have you used? What works well with that? What doesn't work well with that? What would you still like to see improved? And we're kind of talking through all of that history. But then we're also doing a full gait assessment. So they're going to walk, we're going to take videos, we're going to take pictures, and we're going to take time to really assess that. We actually work with a gait expert out of Colorado who helps to kind of do that, because gait is really hard. There is, and especially pediatric gait, because you get a kid and you tell them, okay, walk from here to there, and they do their doctor walk. And that's not their, normal walk. So we take those videos and we really take the time to assess those, because we're seeing them for 30, 45 minutes. That's just a snippet. And so we want to make sure that we really take the time to assess that and talk with, the families about kind of what they've seen.
So what ages do you see kids who are looking for braces for their lower extremities, and up to what age?
Yeah. So typically you're going to see kind of from that pre-walker or kind of right at that walking age. So somewhere between maybe 12 to 15 months, and then all the way up through, late adolescence. And we are just doing pediatric at our clinic. So we're not seeing adults, but many of those users may use bracing into the adulthood.
So are there some kids that would need short-term braces, and then there's some situations where kids would need longer-term braces, I'm assuming? Is that correct?
Yeah.
So can you give us a couple of examples of a short-term brace? When would kids need, what type of conditions would they need a short-term brace for?
Yeah. So short-term brace could be injury related. So, a fracture brace or something like that. We are focusing more on the long-term. So in a short-term type, there's some kiddos who have gait instability, like I mentioned before, where it's not necessarily attached to a diagnosis, but they've got a wide base of support. They have a really swayed walking pattern. They're very guarded when they're walking. And for some of those kiddos, they just need a little bit of stability. And usually that SMO is going to be like the lowest level brace, where they just need to establish that base of support, maybe get a little bit more sensory input into where their foot is in space, and being able to kind of work with their hands and develop their trunk muscles. So we kind of give that stability at the foot so that everything else can get developed, and then they can kind of work out of them. So it's more of just kind of the idiopathic weakness or instabilities. And that, oftentimes they're going to work their way out of. Like I mentioned with the evolution of materials, braces used to kind of lock you up and they gave you support, but you lost some of that natural muscle. Like, we never want to over brace. I can make somebody stand really straight and maybe walk nice, but are they using their quads? Are they, able to develop some of that gastroc, that calf muscle? So some of the materials that we've gotten have really allowed to get stability with also some natural movement, and then just being aware of that. And I think kind of, again, treating that whole person and not just being like, can I improve their gait? Yeah, I probably can, but is that improving their whole life, their whole quality of life?
Yeah, that was actually a question I was going to expand on, because I know my husband had neck surgery a handful of years ago and he had to wear a neck brace for 3 months. And so his neck muscles really got weakened from that. So I was really curious about that. But do you also give like strengthening exercises at all to help accommodate and prevent muscles from getting weaker? Or do you feel like the way the braces are set up, you don't really need that because the muscles are getting activated enough that it's not a problem?
So I would say that's a little out of my scope of practice, but we are saying, hey, you should really be working with a physical therapist on gait training. So we want to make sure that they're getting that gait training by, we may give them like little tidbits here and there, but really they should be working with a physical therapist or occupational therapist to develop that proper gait training. We're partnering with SureStep, which is one of the leading manufacturers in lower extremity bracing, and we're putting on a course. It's designed for a physical therapist in the fact that you'll get 3 CEUs for it, but really any professional who's working with kiddos and gait analysis. So we're doing that March 13th from 4:30 to 7:30. There'll be like dinner catered and everything. And they have courses online that we've done. They are just fantastic in the education perspective. And so they're going to come in. The topic specifically is regarding management of overpronation. That's those kiddos who are kind of the real flat feet walking. So yeah, we're super excited for that. And we'd love for anybody listening that wants to learn more to sign up. We do have a sign up on our website, so you can visit there or you can contact me directly.
Awesome. And then if somebody happens to listen to this and it's past that date, could they just reach out to you to see if you're doing future events or just to maybe get just connect with you knowing that this was a great event that you put on?
Yeah, for sure. If it's a clinic, like if you have a physical therapy clinic and you're like, hey, we all want to learn more, we'll set those up specific just for your clinic. And yeah, we plan to do these hopefully, 2 a year, maybe quarterly. We'll kind of see how this one goes, but we're really excited. We always want to share knowledge and have everybody kind of on that same playing field as far as what those goals are.
I love that. I feel like that's, as a parent listening to that, I feel like that's when you know that the person you're working with is just like has the right heart in what they're doing. So thank you for putting that on. That's amazing.
And really just helping the patient all around, right?
Yeah.
Yeah. From beginning to end. Yeah, for sure.
I can think of a couple of people that I knew when I was younger that had certain situations. So I'm just curious if you help with these maybe shorter term situations, something like clubfoot or
toe walking. Maybe?
Yeah.
I don't know.
Yeah.
As well as we also had a friend, and I think this might be a little bit different, but they had actually one leg that was shorter than the other.
Yep.
Are these things that you support?
Yeah. So clubfoot is, going to be a shorter term where there's a few different methods of treating, but oftentimes it's a serial casting when they're really little, and then they're going to move into a type of brace where it's going to kind of really hold them in a corrected position. And then we're going to use a traditional kind of AFO or SMO to just kind of let them continue to grow out of that. And then, they'll be done with that. The other one you mentioned was toe walking. Toe walking, I guess it could be considered short-term because it's not like a lifelong thing necessarily, but that is, again, another one that's can be really sensory-based.
Yeah.
So you want to make sure that you're working with somebody for that. But the brace is kind of blocking out the movement, not stopping what's initiating the movement. So that's another one where, yes, we can do the brace, but we want to make sure that we're not just doing the brace.
Right.
We're working with, a stretching protocol or a strengthening or a sensory kind of retraining sort of thing. So that's another one that, we definitely see. And then the longer term ones are going to be those spina bifida, CP, muscular dystrophy, kind of looking at, is it a progressive disorder or is it something that's just going to kind of stay stable? And goals can change over time. Like with spina bifida, in our first episode, I mentioned my niece was kind of one of my spark to knowing about this field. And she progressed where she's in a wheelchair full time now. So when she was younger, she used a walker, she used crutches, and she was able to move around a little bit more. But, she's 20 now. That doesn't fit her lifestyle. She's driving. And so she's got her, her van that she rolls into. And so goals can change even if the deformity is kind of still there or the need for that's still there. But we kind of support that through there.
One challenge that I would see with pediatrics that those who fit adults maybe wouldn't have is that kids' legs length is constantly growing.
Yeah.
So how do you accommodate that?
You get new braces.
Oh, okay.
Okay.
So let's walk through that a little bit.
Yeah.
How often would that be?
Usually about a year. Usually if, sometimes it might only be 6 months if you like really hit a growth spurt. We do try to, make the brace have a little bit of room, but they're custom fit and they have to be snug. You can't have this big loose brace or you're going to get skin breakdown or, a toe, like foot plate that's 2 inches longer, well, that's not going to support them in a natural, to get the most natural gait. So you're typically coming back for appointments, yearly for new braces or anywhere between 6 months and I'd say 18 months.
You had mentioned injury as a potential need for a shorter term brace. What would be the need for a brace versus like a cast? Obviously a cast is going to be a break, but like how would you help with an injury? And then I'm also curious on when a kiddo is wearing a brace, how does that limit their movement? Like running, kicking, obviously all of that is going to change a little bit.
Yep. So fracture braces would be an example. So like a walking boot. Sometimes if depending on the kid's age, if they're maybe like taking it off or messing with it, they might need something that's a little bit more designed to be a snugger fitter that they can't just kind of remove. There are like arm fracture braces. We don't do a ton of that. We are really focused on the custom stuff. But there are some off the shelf options where if there's, if you can't get that somewhere else, that's something we can order in. So yeah, the fracture bracing would be one of those examples. What was the other question?
It was about how does that impact a kiddo and like how are they limited in movement?
Yeah. So we always want to make sure that we are, like I said, bracing kind of at just the right level. So we're not over bracing them and they can have movement. Now there are limitations to that. If we're locking out angle of movement, it can be harder to kneel, to crawl, to play on certain things. So we're very conscious of that, but there is kind of the reality that it can be hard.
And I like to think that older kids would be able to respect those boundaries and they understand, this is short term to have long term games, but it's more of like those toddler years where they don't quite understand, where I could see it being really tricky to navigate. Like our parents having to kind of walk on eggshells of like, don't do this. Oh, don't do that. Because they want to climb and they want to do all this other stuff.
Oh, no. I think they're going to okay. So an example would be, we just had a little kiddo. He's just about a year and he's starting to pull to stand and mom's like, he won't stand in the braces. Like he just won't stand. And if you kind of picture like, when you take a baby and you put them above the grass and they like lift their feet up, like the grass is not going to hurt them. It's just a new kind of sensation. So he did not want to wear his braces and mom was feeling like really stressed about this. And so she came back in and I talked to her and she came in the next week and she's like, actually, he's doing better. Sometimes it's just repetition. It's just practice. Have him on while he's playing and doing something and completely distracted and just gets kind of used to that. So the younger kiddos, it's just kind of meeting them where they're at, right? We can't force them to do this. And then once they realize, hey, when I have my braces on, I can actually stand up better. And then I can play with my toy better. And then I can move better. They will learn that pattern that, this is easier when I have these on. But it can take some time. And so I think just meeting them where they're at and not trying to, it's a big thing, right? Helmets, we see that. It feels like the end of the world to families. We're like, to me, I'm like, it's a helmet, it'll be 2 months and it's no big deal. Like, right. I know that. But I also know that families are like, oh my gosh, like it's hard. And we don't try to like push that down and be like, deal with it. Like we get that. And we'll try to help and support you through that. And I think the same thing with bracing too, that like, we'll get through this. And with these kiddos, like oftentimes too, it is a longer term thing. This is kind of a perpetual thing that we're going to be dealing with. So maybe we learned something from that brace. Like, that brace worked really good to help them walk, but they could not squat and play in the sandbox. And that's important for them in the summer. And so we try to figure out, could there be something else? Could there be a 2-stage brace where, they kind of have a brace for when they're playing, and then like school age kids. In school, you're typically walking more, you're playing. You might need more stability in school and in higher walking activities, or you're going to an amusement park. You need more stability there than you do when you're laying around watching a show or just kind of playing around home. So trying to find that balance and not just, they can walk better. That's not the ultimate goal oftentimes.
And that's why I love that you're a custom clinic.
Yep, I was just going to say that. I just love your attitude and your support for these families. The realistic, you're just being realistic.
Something else we're implementing is like not only talking through this with families, but truly giving them an option. Like, here are 2 treatment options that are both completely appropriate, writing out that kind of comparison and what goals those are, and handing that over to the families and saying, what's going to meet your family's goals? And so it's not just like us making that decision, because I have the clinical expertise, but you have your child's expertise. So finding that balance between both and making sure it's that quality of life improvement.
Well, and you want them to be successful ultimately. Yeah. And if it's a plan that's not going to work for them, it's just then you're wasting everybody's time, right?
Yeah.
So want to make sure it all works.
Yeah. And I actually do have two more kind of logistical questions that, as somebody who has never had to experience pediatric lower limb orthotics, I just am curious about. Are there some of them that you would need, that parents would need to buy special shoes for, as well as what are kind of the costs? So two different questions.
So the shoes, that is the number one hardest thing. It is hard to find shoes that fit, that are cute, because you do have to typically you size up a little bit. And then also like that adds depth. So you're wrapping around the foot, that's adding depth. It's hard. That's something we recognize, and we do have about 7 different types of shoes in our clinic. So you can touch them, you can feel them, you can see where the zippers run, and really trying to not just give a paper sheet that says, hey, here are some, but you can touch and feel them. Now, we're not in the shoe business, so we're not, ordering them, but we're helping to educate you so you can really get that, because it is hard. That's like probably the number one thing families who have kids that wear AFOs is like, it's hard to find shoes and cute shoes. Again, technology, there's come a long way. Billy is a really great brand. Friendly Shoes is one that has like a special zipper design, but it's a challenge. That's for sure. Cost, it's hard to answer because it's really going to depend on the type of brace, the level of brace, and again, insurance. We do work with Medicaid, so that's, I think, something important that families know. But there's kind of a wide range of cost.
Sure. But
we're always doing a financial responsibility before we're ordering and committing. So there's no like surprise bill at the end, like, what? These braces cost $2,000. I wouldn't have done that or whatever. Mm-hmm. We try to be very transparent, probably over transparent in our, in that financial responsibility, because we never want to have a financial hardship put on a family that they're not expecting.
Yeah, no, this is perfect. This really helped open my eyes to kind of this topic, because it's something I've never really talked about. It's not something our family has experienced, but there are a lot of families out there who are. So thank you for sharing this information. If somebody would like to contact you to ask any questions about what they learned today, what's the best way to contact you?
Yeah, so you can always email me. It's Cassie at Baby Bear Clinic, our website, babybearclinic.com. There's going to be lots of information on there. There's you can directly email me from there. Those are going to be the best ways.
Perfect. Do you have social media that you're active on as well that people could follow you at?
Ooh, good question. So yes, our Baby Bear, our cranial page is super active and awesome and has so much information. We are working on building up our lower extremity page. We'll have separate Instagrams, just because I think once you're zoned into what you want to do, you want to binge on that.
Sure.
So our lower extremity one is not yet out, but we are working on it.
Okay. So watch, would you be announced? How would people find out when that is available? Just, would you announce it on your cranial page? Is that something they could follow for now to at least stay in touch?
Yep.
Okay. Perfect. Well, we have one more episode together. We are excited to talk a little bit more about scoliosis in our next episode, which is something I think actually is more common than a lot of people even think. So stay tuned for that episode. That'll be the next one coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.